Proper care of newborn calves is critical to setting the stage for the long-term health and productivity of your herd. The National Dairy Farm Program details best practices for newborns when it comes to nutrition, animal health, environment and facilities, and handling, movement, and transportation. Calves must receive colostrum or colostrum replacer soon after birth. Providing an adequate volume of high-quality colostrum or colostrum replacer is critical to calf health because calves depend on colostrum for immune protection. Dairy calves are born with no natural immunity and depend on the immunoglobulins in colostrum to provide passive immune protection. Colostrum also increases the calf's tolerance to cold temperatures. Colostrum or colostrum replacer should be fed within the first few hours following parturition to promote immune system development. Large breed calves should be fed 4 quarts or more at birth. Small breed calves should be fed at least 2 quarts of high-quality colostrum at birth and an additional 2 quarts 12 hours later. After receiving immunity through feeding colostrum or colostrum replacer, calves should be fed milk or milk replacer until weaned. Milk replacers with protein derived from dairy products are the most easily digested. The milk replacer should mix easily in water and stay in solution after mixing. Water used with milk replacers should be fresh and clean. Calves should have continuous access to fresh water or are watered at least twice a day, or as necessary to maintain proper hydration. Calf rations provide the required nutrients for maintenance and growth and stimulate rumen development. A palatable, high-quality starter ration should be offered within 2 weeks after birth, and forage should be offered along with the grain-based ration before 12 weeks of age. A sound nutritional program will ensure that calves reach their genetic potential and that many problems later in the mature animals will be avoided. When it comes to the health of newborns, the dairy should have a herd health plan developed in consultation with the herd veterinarian or other knowledgeable professional. It should include specific areas pertaining to newborn animals. Necessary medical procedures should be done at the earliest age possible by a veterinarian or properly trained personnel and with appropriate use of analgesics and/or anesthetics. Nables should be dipped in an effective antiseptic solution as soon as possible. If the umbilical cord is not severed immediately after birth, it may be tied 2 to 3 inches from the calf's body. Wet cords are entry points for pathogens into the calf's body. An effective preventive treatment is to dip the navel repeatedly into a solution of chlorhexidine or tincture iodine. Animal identification and animal health records should be maintained as they are critical for making important management decisions about feeding, grouping, selecting, medicating, breeding, and culling an animal from the herd. A newborn calf should be permanently identified. The National Dairy Farm Program recommends participating in the National Animal Identification System and using official 840 RFID ear tags. Vaccinations for common diseases should be administered for disease prevention. Vaccination should be administered to all replacement heifers, recording the date of each vaccination. At times, euthanasia for a newborn may be necessary to humanely deal with complications from birth or other conditions. Euthanasia should be consistent with recommendations from the American Association of Bovine Practitioners. Regardless of the medical procedure, it should be completed as soon as possible and with appropriate use of analgesics and/or anesthetics. Procedures such as dehorning, castration, and supernumerary teat removal should be done at the earliest age possible by a veterinarian or properly trained personnel. Please refer to Chapter 4 of the Animal Care Manual for more information. Tail docking of dairy calves is not recommended. A thorough review of the scientific literature does not support anecdotal reports of the benefits of tail docking. Switch trimming is recommended as a preferred alternative. Environment and facilities for newborn calves requires that a clean, dry, well-lit, well-ventilated calving area is used. Wet, dirty calving areas foster the growth of bacteria that can invade the newborn calf's navel or mouth and create a disease load that overwhelms the calf's naive immune system. A separate calving area designed to be comfortable, functional, and hygienic allows for close observation of the cow and easier, more effective assistance at calving. Calf hygiene can be scored on a point system and be used as an indicator of pen and facility cleanliness. Please refer to Chapter 6 of the Animal Care Video and Animal Care Manual for more details on hygiene scoring. Calves should be housed in a clean, dry area with adequate space to stand, lie down, and turn around without difficulty. Calves should be protected from extreme temperatures, wind drafts, and precipitation during seasonal weather extremes. During cold weather, ventilation in houses for newborn calves should maintain acceptable air quality in terms of water vapor and other pollutants without chilling the animals. Avoid drafts or direct breezes on young animals. Blankets can be used to keep a small calf warm to limit the amount of energy the calf uses. When handling, moving, and transporting, calves should be moved by lifting or walking. Personnel should be trained to handle and restrain calves with a minimum of stress to the animal. Calves should be handled in a calm, controlled, and gentle manner. Employees should be properly trained in animal handling, and the consequences of inhumane handling should be known and enforced. Handlers should be assessed and retrained on a regular basis. Vehicles used to transport calves should be clean and properly designed and maintained. Handling facilities, including trailers, must be well maintained and free of objects such as broken boards or rails that may cause bruising.